Hello, this is Dr. Julie Kodev, and this is Human Anatomy by Martini, Chapter 10, the muscular system or the axial musculature. So our skeletal muscle of the body can be subdivided into these two different divisions, just like we did with our bones. And so we see the axial musculature, or that center area, and the appendicular musculature, or more associated with our extremities. So our axial musculature arises from and inserts on the axial skeleton. So the muscles that help position our head, our spine, muscles that move our rib cage, assist in movements that make breathing possible. The appendicular musculature, so these are the muscles that stabilize or move our appendicular skeleton. Or think of the extremities. Muscles of facial expression. So we will see facial nerve, cranial nerve 7 in a couple chapters from now. So cranial nerve 7 is the nerve that it's going to control muscles of facial expression. So we see orbicularis oris. So remember, orb is going to be circular shape. Oris refers to oral or the mouth. Buccinator. So remember, this one is helpful to musicians, as in playing the trumpet. Orbicularis oculi, so again, the circle of the orb, oculi is for our eyes. Frontal and occipital bellies of the occipitofrontalis muscle is going to control our eyebrow, our forehead, okay? And our scalp, or the back of the scalp area there, is where the attachment is, but it's going to control all of the scalp. And then the platysma is going to be a big band of muscle at the neck, and that's all going to be facial nerve or cranial nerve 7. So go ahead and take a look at this picture here, and we'll see orbicularis oris here, the circular muscle here. So see the circle up here too? That's the orbicularis oculi. Okay, and then we see nasalis right here for the nasal area. Platysma was mentioned on the previous slide, and that is this whole muscle here, the sheet of muscle. Remember that this is bilateral and symmetrical. It's just this is superficial or towards the surface, and that has been removed. See how it's been cut and reflected on this side here? So we can see deeper muscles on this side here. Okay, so this muscle right here, SCM, is going to be cranial nerve 11 and not 7. Okay, so not everything on here is going to be 7. And then you can see the buccinator over there on the right, just underneath the masseter here. So you could see buccinator right in there for you. Good. All right, so feel free to pause on this for as long as you need to. Check out the frontal belly of occipital frontalis. This is the frontal bone right here. That's the muscle there. And then this is that aponeurosis, or that big band of fascia or connective tissue. And then on the back side, you're going to see the occipital component of occipital frontalis. Extraocular eye muscles. Yes, these are for our eye muscles. Movement of our eyes. Look left, look right, look up, look down, look at your nose. This is going to give us all of the directions that we just did there. So this is going to be cranial nerves 3, 4, and 6. And then right here, okay, so we see lateral rectus off to the side, and it's straight. Medial towards our nose, and it's a straight muscle. Superior rectus, inferior rectus, okay? Superior oblique muscle. This one's kind of a funny one, because on its own, we talk about how it rotates the eye down and lateral, but in reality, when we test it, we have you look at your nose, because it is this weird diagonal muscle for our eyes. Okay. Inferior oblique, again, those oblique muscles are at that angle right here. So you can see it right here. So we can see the center of the eye, and then our medial rectus, again, that's straight, and this is towards the nose here. Okay, lateral rectus would be this way. Superior rectus, inferior rectus. Now these are those goofy muscles right here. You can see superior oblique, and you're going to see this kind of pulley system here. We call it a trochlea right there, and then the muscle here. Okay? Same thing for inferior oblique. It's at this weird angle. Okay, so these are just our extraocular muscles or our eye movement muscles. Muscles of mastication, that means chewing. Masseter is going to be the strongest. Then we're going to see temporalis, and that's going to be over where your temples are. And then pterygoids, the P is silent, okay, pterygoids. We're going to see medial and a lateral pterygoid. And this is going to be controlled by trigeminal nerve, okay, or cranial nerve 5, and act on the mandible. And you can see them right here. So temporalis right at the temples here. Okay, temporalis. And then we see masseter. You could see why that would be a muscle of mastication or chewing. And then you can see the pterygoids here, lateral and medial pterygoid. So let me color code that for you. Medial pterygoid. Ah. And lateral pterygoid. Great. Anterior muscles of the neck or front muscles of the neck, we're going to see digastric. So what we want to see here is di being 2 and gaster, think of gastric, right? Belly. Okay, there's a belly to the muscle. So this has 2 bellies for this muscle here. And we'll see it in a moment. And then our mylohyoid, that's going to be deep, not superficial, but the opposite, deep to the digastric. Sternohyoid, sternum to the hyoid bone. Sternocleidomastoid, or SCM, has 3 attachments: the sternum, the clavicle, and the mastoid process of the temporal bone. We see the control here. Okay, so they're going to control the position of the larynx, which is your voice box, depress the mandible, and provide a foundation for the muscles of the tongue and the pharynx. Pharynx is just medical terminology for throat. You can see them right here. So here's mylohyoid right here, cut away. You can also see it right here and a little bit right there. Digastric, 2 bellies, an anterior belly and a posterior belly. 2 bellies, an anterior and a posterior belly. So see it right here. Here's anterior belly and the posterior belly. It has one of those weird little trochleas here too, that you can see that little connective tissue there. Here's the hyoid bone right here for you. Okay, so the hyoid bone. And then we see stylohyoid. That's just telling us it's coming from the styloid process to the hyoid. Thyrohyoid from the thyroid cartilage to the hyoid. So it's basically just telling you where it is. SCM, or sternocleidomastoid. It's being cut away here. You're going to see it here from the mastoid process to the sternum. Okay, and then this other belly of the same muscle from the mastoid process to the clavicle. What's the cleido part is clavicle. Okay, so sterno, cleido, mastoid process. Okay, not this bone here, but you can imagine it back there. It's on the temporal bone. Great. Omohyoid, omo just means shoulder. So this has a superior belly and an inferior belly for this omohyoid muscle. Okay, so superior belly right here and inferior belly right here for omohyoid. So going from the shoulder, omo, to the hyoid. Great. You see mylohyoid up here as well. So front teeth right here, top. Oops, there you go. You can see the teeth right here and the hyoid bone right here and mylohyoid right there. Okay, genioglossus, that was, so the tongue is here. Okay, the tongue. Glossus is tongue. You can see the mylohyoid at the bottom of the jaw right there. Good. So muscles that form the floor of the oral cavity, so your bottom jaw. Examples of extrinsic back muscles, superficial layer of extrinsic muscles. So we're going to look at trapezius and latissimus dorsi, and I'll show you how to remember the difference between the two. So let me get my pen here. All right, trapezius is up top here. Latissimus, okay, is lower. L for latissimus, L for lower. And you're going to see it retracted away here, but it's this right here. You can see him on this side here. Okay, so this is the latissimus. Let me clean that up for you. Okay, this is one side of the latissimus here. Okay, lats lower. Okay, and it's bilateral and symmetrical. Okay, so it would be on this side as well. Lats lower, traps top. Okay, trapezius, this giant muscle here. Let me move some stuff around. Okay, right here. Now, there is going to be an upper, middle, and lower trapezius as well. Okay, but those big superficial back muscles there. Traps top, lats lower. Axial musculature here, example of extrinsic back muscles is where we're at. Intermediate layer of these extrinsic muscles. So we're going to look at serratus anterior, and it's innervated by the long thoracic nerve, which is superficial and vulnerable. So there's a mnemonic for this. Serratus anterior, long thoracic nerve, SALT. Okay, SALT. And if this is damaged, you'll see a winged scapula. Okay, winged scapula. And you can see the muscles here of serratus anterior. So serrated, like a knife edge is serrated, or serrated like a tree's leaf is serrated. So you'll see that serrated edge there. There's a serratus anterior, there will be a serratus posterior as well. Okay. You can see the coracoid process here and the muscles attaching there, coracobrachialis, and we could see the bicep here. Okay. And then the other muscle that attaches to that coracoid process is pec minor right there. And you can see trapezius, so our upper traps of our shoulders, they're usually pretty tight and tender sometimes. Subclavius, sub means under. Clavius is going to be clavicle. Oops, I got a little wild there. There you go. Clavicle. And so subclavius muscle is going to be under the clavicle. Great, right? And what else do we see? We see levator scapula, so that's going to attach to the scapula there on the back. Okay, and elevate the scapula. And then we see internal intercostals and external intercostals here. Inter is in between. Costal means rib. So these are just the muscles in between the ribs. So those are our major respiratory muscles, those external and internal intercostals, and the big one here is going to be the diaphragm. This is this dome-shaped muscle of breathing. It expands the thoracic cavity for inhalation. It's kind of like when you press down and create this negative pressure, kind of like when we have our one-piece bathing suits or an accordion. Okay, it's going to create this pressure and it's going to separate that abdominal, pelvic, and thoracic cavity. We'll see the rectus abdominis. Again, remember that is just straight up on the abdomen. It flexes the vertebral column, so sit-ups. Okay, divided longitudinally by the linea alba, which is just a white line, and then divided by the tendinous inscriptions here transversely. This is what's going to give that six-pack appearance, is these two components right here. Right here. So tendinous inscription. Okay. And then the linea alba. Oops, let me move that. There you go. This white line in the middle here. Okay. We see our internal and external intercostals again, in between the ribs. External oblique is an abdominal muscle. You can see it better over here. And then you can see the internal oblique right here. Okay. Good. And you can see serratus anterior. So see those serrated edges, those little finger-like edges there? So oblique and rectus muscles here. So abdominal oblique muscles, the external obliques rotate the vertebral column, and so do the internal obliques. Just look at the difference here of the orientation of the fibers. So they kind of go one on top of the other here. Transverse abdominals compresses the abdomen. Okay, so when you inhale and you try and suck it in order to put on a pair of pants that doesn't quite fit. That's what we mean by compresses the abdomen. And you can see a viewpoint here. This is the L3 vertebra here. So this is going to be a horizontal section or a transverse cut through the abdomen here at L3. And we're going to see the front here. So you can see rectus abdominis here. Okay. And then you can see the external obliques. You can see the internal obliques, and you could see the transverse abdominis. Okay, so from external to internal. We're going to see psoas major here, major hip flexor, and then quadratus lumborum here, major hip extensor. And we already looked at that latissimus dorsi. Really interesting view of where that latissimus dorsi is, right? Great. Muscles of the perineum and pelvic diaphragm. So they extend from the sacrum. So remember, the tailbone is going to be the sacrum and the coccyx. So 5 fused bone of the sacrum, 3 to 5 fused bone of that coccyx, COCCYX, to the ischium and the pubis. So the ischial bone and the pubic bone here. Main functions: to support the organs of the pelvic cavity, flex the joints of the sacrum and the coccyx, and control the movement of material through the urethra and the anus, or expel the urine and feces. And then you can see this viewpoint here from the bottom up. This is the inferior view of a male. And we can see glute max here for orientation of where we are. And then you can see the pelvic diaphragm here. So from pubic to coxal bone, ilium to coccyx bone, coccygeal muscle right here. And then inferior view of female here. And so you could see coccygeus muscle here again. You can see the sacrotuberous ligament here. So sacrotuberous ligament is from the sacrum, okay, to the ischial tuberosity. That's what the tuberous is, the ischial tuberosity, or that sits bone that we sit on. Okay, so remember our ilium, our ischium, and our pubic bone. So the ischial tuberosity. Good. And then you can see a couple of other muscles here. So you could see the central tendon of the perineum here. Tendons, again, connect muscle to bone. You can see levator ani here, so it elevates the anus. So pubics to coccyx, ilium to coccyx, that's what those muscles are doing. Good. And that completes this chapter here. So I'll see you for the next chapter.